A stillborn baby vanished from a Fresno County hospital without a funeral, a name, or a trace. For 34 years, no one questioned it, until a birth record surfaced that didn't match any registered death. What was supposed to be a quiet teenage delivery in a public ward turned into a missing person case with no witnesses and no investigation. The mother, Rosa Delgado, was 17 years old, alone, on state coverage. No visitors listed. She labored overnight and was told the baby never took a breath. The records were thin. A single notation: stillbirth, female, 4:16 a.m. Then discharge, same day. Rosa never saw a body. She was told the remains had already been taken by the time she asked. Security footage from that week was erased after 30 days per hospital protocol. No autopsy was filed, no paperwork mailed, no grave listed. She left the hospital before noon, wearing hospital socks and carrying state-issued crackers. The staff described her as calm, quiet, compliant. She never returned, and she never had another child. The case was considered closed until a flagged digitization project in 2024 uncovered something strange. 2 identical birth files, same timestamp, same mother, same delivery. One marked deceased, the other marked transferred to pediatric observation at 5:02 a.m. No attending signature, no discharge scan, no recorded recipient, and no further record of where that child went. Rosa Delgado was 17 when she found out she was pregnant. She didn't cry. She didn't tell the boy. She didn't tell anyone for almost 2 months. She'd been living in transitional housing for minors, an old motel complex repurposed by the county, room 214, just past the broken vending machine. 2 other girls rotated through the space while she was there. Neither stayed long. Neither learned her name. The pregnancy was confirmed at a free clinic downtown. Her intake paperwork had to be corrected 3 times. The staff was polite but distant. They told her the baby looked fine. No flags, no risks. She nodded, signed the form, and walked back alone. Her school attendance dropped. One teacher marked her as disengaged but compliant. Her social worker changed twice in 3 months. At no point did anyone suggest a long-term plan. She worked part-time at a laundromat off Jensen Avenue, handling folding, vending machine restocks, and overnight lockup. The owner paid her in cash. She stopped showing up in her 3rd trimester. No one followed up. There were no baby showers, no rides to appointments, no crib, no photos, no one asking what name she had picked. She'd chosen a name quietly, Isabel. She wrote it once in the back of a notebook, then tore the page out and flushed it down a gas station toilet. That was the only time she ever saw it in print. Her prenatal care consisted of 3 documented checkups. Her file described her as low-risk, unaccompanied, Medi-Cal eligible. She missed her final ultrasound. The clinic had relocated to a new floor. No one called to inform her. No one added a forwarding number. She kept her meals small, mostly crackers and vending machine fruit cups. Her weight stayed low. She told herself it was better that way. Less pain, easier exit. One roommate offered to drive her to the hospital when the time came, but left the facility 2 weeks early for a different placement. Another said nothing at all. On June 3rd, she packed a tote bag with 2 clean shirts, 1 pair of socks, and 2 folded $20 bills. She walked 6 blocks to a Chevron station, used the payphone out front, and asked for an ambulance. The call was recorded. She was calm. She told dispatch she was alone. She did not want police presence. She did not request a caseworker. She waited seated against the wall, her knees drawn up, arms wrapped around them. A clerk offered her a bottle of water. She took it without speaking. When paramedics arrived, she climbed into the ambulance on her own. Her file notes, her vitals were stable. No signs of distress. She thanked the driver before they pulled away. Her hospital intake sheet was time-stamped 11:03 p.m. She was admitted to a shared maternity suite. Her assigned nurse changed shifts at 3 a.m. The birth happened during transition. No family listed, no contact number, no plan on file. She had chosen to give birth alone. The delivery began just before 3 in the morning. Rosa had been admitted the night before, walked in through the emergency entrance, and taken to maternity by a transport nurse who never asked how she got there. Her vitals were stable. Her demeanor was described as cooperative, soft-spoken, visibly tired. She was placed in a shared room. The other bed remained empty. At 2:12 a.m., her contractions became regular. She was 7 centimeters dilated. The nurse assigned to her care had just come back from a break. A new IV was started. The lights were dimmed. The monitors recorded mild decelerations, but no critical drops. The fetal heart rate was listed as intermittent, unverified. A Doppler reading was attempted, but not documented. The resident physician on call signed off at 3:28 a.m. There was no attending present. The pushing stage lasted 19 minutes. No complications were logged, no code was called, no equipment malfunction noted. There is no record of an APGAR score. At 4:16 a.m., a notation was entered into the chart. Fetal demise, female, no resuscitation attempted. The nurse wrote that the patient was informed of the outcome and given time to rest. Rosa remembered asking if she could see her. The nurse's response was documented only as declined per protocol. By 4:25, the baby was no longer in the room. What happened in those 9 minutes was never reviewed. There was no chain of custody form, no transfer slip, no coroner's intake. The neonatal logbook for that night contains a gap between 4 o'clock and 5:30. The entry before lists a routine delivery. The entry after refers to a transport to NICU with stable vitals. Rosa's case appears in neither. At 6:40 a.m., her chart was updated again. Patient resting, alert, no complaints. She was offered toast and juice. She declined. At 8:10 a.m., she was seen briefly by a discharge nurse. Her physical recovery was described as within normal limits. There is no mention of grief counseling, no referral, no follow-up scheduled. The only personal note in the file appears next to a line labeled patient behavior. One word, compliant. She was discharged at 11:38 a.m. The paperwork was signed by a nurse who had not been present during the delivery. She was escorted to the hospital exit with a paper bag containing gauze pads, crackers, and a courtesy water bottle. No one asked how she was getting home. Outside, it was already 94 degrees. Rosa stepped into the sunlight wearing hospital-issued socks and a borrowed pair of sneakers. She stood on the curb for several minutes, then began walking south toward the bus depot. She didn't look back. That same day, the hospital recorded the birth of 4 infants. All were documented. All were weighed, printed, and issued temporary tags. All except one. There is no photograph, no weight, no footprint, no printed wristband. Only the line that reads, stillbirth, female, 4:16 a.m. And another, recorded 46 minutes later, in a different system. Transferred to pediatric observation, 5:02 a.m. No name, no ID, no body, just time and silence. There was no search. Stillbirths don't trigger investigations, and Rosa Delgado wasn't in a position to demand one. She returned to the transitional housing facility the same day she left the hospital. The staff made note of her re-entry, but didn't ask about the delivery. Her file was updated with a sticker, medical recovery period active, no restrictions. She stayed in bed for most of the first 2 days. No one visited. No one offered condolences. No one documented any concern. By the end of the week, Her cot had been reassigned to a new arrival. Rosa was moved to a quieter room on the second floor, closer to the janitorial closet. She didn't object. 1 week later, a social worker conducted a routine welfare check. The notes mention a conversation about housing vouchers and GED prep, but there is no record of Rosa bringing up the birth. The child is not listed in the case summary. The father was never identified. The intake documents list the alleged paternal party as unknown. There was no father listed on the fetal certificate. No one came forward. Rosa's extended family had been distant long before the pregnancy. Her mother had moved out of state. A half-sister in Modesto hadn't spoken to her in 3 years. There were no legal guardians, no next of kin, no one to ask where the baby had gone. Weeks passed. The bleeding stopped. Her appetite returned. She took shifts again at the laundromat. When asked by a coworker how she was doing, she said, "Fine." There were no public obituaries, no funeral, no ashes returned. Rosa had not been given the option. She called the hospital once, 4 weeks later. The operator transferred her to medical records. She was put on hold, then disconnected. She didn't call back. The following month, she moved into a small studio funded by a youth housing voucher. Her name changed on some forms, Rosa Delgado Cortez, but the birth record remained under Delgado. No one connected the entries. By fall, she had stopped talking about it entirely. She didn't speak to anyone about the delivery, not even the counselor she was assigned through the shelter program. When asked if she had ever had children, she paused and said, "Not anymore." No photos were taken, no birth announcement, no journal, no physical trace of the child remained. The file stayed closed. In official records, it was over. The hospital archived her case. The fetal remains were marked as released. Where they were released to is unclear. The cremation log doesn't list a tag number. The morgue has no intake file for that date. It wasn't until 2009 that Rosa, now working as a receptionist at an apartment complex, tried to request a copy of the death certificate. She was told nothing existed. A staffer at the Office of Vital Records suggested it was a data loss issue, common with legacy formats from the early 90s. She offered to create a manual entry. Rosa declined. She never asked again. She never filed a complaint. She never searched. Because you can't look for someone the world tells you never existed. The explanation, when it finally came, wasn't from the hospital. It came from a glitch. In 2024, the California Department of Public Health contracted a third-party firm to digitize legacy birth records. Tens of thousands of files scanned, indexed, and cross-referenced against modern registries. In most cases, discrepancies were minor: misspelled names, incorrect dates, missing Social Security assignments. But on September 12th, during a routine review of hospital records from the early 1990s, an analyst flagged a pair of entries from the same facility. Same day, same hour. 2 births, same mother, same file number, same timestamp. One marked deceased at 4:16 a.m. The other marked transferred to pediatric observation at 5:02 a.m. No twin designation, no attending overlap, no duplicate report filed. The system logged the conflict and automatically opened an internal review. A week later, the anomaly landed on the desk of an auditing coordinator. She searched both entries. The first had the standard fields for a stillbirth: date, time, gestational age, mother's name. No weight, no prints, no coroner ID, no autopsy ordered. The second entry had the same maternal data, but a different status. No vitals, no discharge, no transfer location. The child was listed only as infant female Delgado. Disposition, pediatric observation. Signature line, blank. The case was escalated. On October 3rd, a formal request was issued to Mercy Valley Hospital, now operating under a new name and ownership. Medical records replied 3 days later. The facility had changed database systems twice since 1998. All paper files had been scanned or destroyed. The delivery logs from 1991 were no longer accessible. The neonatal logbooks had been discarded during the last flood recovery. No microfilm had been retained. The morgue logs from that week were intact, but showed no body tagged under the Delgado name. There was no cremation record, no burial index, no anatomical donation, no fetal transfer to pathology. The official explanation was simple: clerical error, a misfiled code, possibly a duplicated entry, possibly a nurse inputting the wrong time. An audit investigator pushed back. The records were too specific. The second file included a transfer code used only in live births. It was timestamped 46 minutes after the listed time of death, and it was placed in a different system. The answer came back again. Legacy glitch. No action taken. The file was updated with a note: no indication of live outcome. Retain classification as stillbirth. Case closed. No one contacted Rosa Delgado. Her name was listed in the system, but her current address was outdated. No attempt was made to verify. The audit concluded the error had no legal consequence. 3 months later, the file was quietly marked resolved. The case had returned to what it had always been: a ghost entry in a system that didn't want to admit how many names had been lost. Rosa Delgado never moved far. Over the years, she lived in 6 different apartments, all within an hour of the hospital where she gave birth. None of them had a nursery. None had more than 2 chairs. She never bought children's clothes, never shopped for toys, never walked near the baby aisle at the pharmacy. She worked, mostly, and she kept to herself. In 1995, she got her GED. 2 years later, she enrolled in a vocational office training program. She completed it in 8 months. Her instructors described her as punctual, quiet, unremarkable. She never missed a single class. She got a job as a receptionist for a tax preparation office, then another in property management. Her file was clean. Her evaluations were steady. No write-ups, no concerns. She paid her rent on time. She stayed out of sight. The name Isabel never came up again. For years, Rosa avoided anything that reminded her of the hospital. She refused to schedule doctor visits at any affiliated clinic. When dental appointments sent her across town, she rescheduled them without explanation. She stopped answering calls from blocked numbers. She refused to fill out census data. She marked the box, "No children." When people asked if she had ever been pregnant, she would say once, briefly, but the baby hadn't made it. No one pressed. She made sure of that. She didn't attend baby showers. She never went to baby birthday parties. A coworker once left an ultrasound photo on the staff fridge. Rosa stared at it for a moment, then walked into the break room and threw it away. She kept to patterns. Lunch at the same bench. Groceries on Sunday morning. Rent paid 3 days early. Every January, she got her flu shot. Every March, she cleaned out her kitchen cabinets. Every June, she took a day off work without explanation. She never said why. She spent her evenings watching muted television, cooking shows, courtroom reruns, home repairs with no narration. The kind of noise that kept her company without asking anything back. She had no major medical events, no legal records, no psychiatric history. She paid in cash when she could. She moved slowly. She kept copies of everything. In 2006, she began attending a grief group that met weekly in the basement of a Lutheran church. She never spoke. She never shared. But she sat in the back row for nearly 2 years. She brought coffee once. People noticed but didn't comment. She stopped going after someone asked if she'd lost a husband. By the time she was in her 40s, Rosa had built a life that looked like stability from the outside. Work, rent, groceries, laundry. She wore beige cardigans. She left notes for herself in neat block letters. She kept an emergency bag by the door. But she never dated, never adopted, never fostered, never volunteered. She told herself it was better that way. Because some absences aren't just grief. They're geometry. They shape the space you live in, and once that shape is made, it doesn't change. The error wasn't discovered by law enforcement. It wasn't flagged by a family member. It didn't appear in a podcast or on a message board. It started with a digitization project, one of hundreds commissioned across the country. In 2024, California's Department of Public Health contracted an archival software firm to process over 1 million handwritten birth records from the late 20th century. The task was to clean the data, standardize formats, and close the gap between analog and electronic storage. The process took nearly a year. Most of it was routine. In August, a contractor named Paige Anders was working through entries from the early 1990s. She wasn't a doctor. She wasn't an investigator. She was a 26-year-old data technician from Sacramento. Her job was to flag missing fields and duplicate entries from manual review. On the morning of August 12th, she flagged a file from Mercy Valley Hospital. The mother was listed as Rosa Delgado. The baby, female. Date of birth, June 4th, 1991. Time of birth, 4:16 a.m. Disposition, fetal demise. No footprint. No weight recorded. No prints. That wasn't unusual. What was unusual was the second record. Same name, same mother, same hospital, same birth time, down to the minute. But this one wasn't marked deceased. It was logged 46 minutes later in a separate system, pediatric intake, and tagged as transferred to observation. No ward listed. No initials on the form. No attending physician signature. The discharge column was blank. Paige paused, then checked for a twin notation. There wasn't one. She searched the facility's admission logs. The only birth listed for Rosa Delgado that day was the one marked Stillborn. There was no duplicate ID, no separate room. The system didn't know what to do with it. She escalated the record to a supervisor. Within 48 hours, a compliance officer had reviewed both entries. Then a second, then a third. Each came to the same conclusion. The files shouldn't exist together. One should have overwritten the other. But neither did. They coexisted, one confirming death, the other implying survival. The second record had never been printed. It had never been filed. It had no attached physical documents. It existed only as a digital ghost, a remnant left in a system that had since been migrated, updated, and buried under decades of new records. An audit request was sent to the hospital, now under new ownership. The response came back within a week. All neonatal logs from 1991 had been discarded after water damage during a renovation in 2007. Backup files were incomplete. Microfilm reels had never been digitized. There was no remaining paper trail. The file should have ended there. But someone had added a note, undated, unsigned, in a hidden field at the bottom of the transfer record. Just 4 words typed in all caps. Do not pursue further. No reason given, and no indication of who wrote it. The building had changed names twice. What was once Mercy Valley Hospital was now a specialty outpatient center for surgical rehab, occupying the shell of a place most people had forgotten. The original maternity ward no longer existed. The East Wing had been gutted and remodeled into exam rooms. The signage was new. The paint was fresh. But the foundation hadn't moved. In October 2024, A field agent from the state's Medical Data Integrity Unit visited the site after a formal request was approved by the Regional Oversight Board. The visit wasn't publicized. It wasn't announced to staff. The goal was simple: verify that no paper records remained. The visit lasted 38 minutes. A facilities supervisor led the agent through the lower corridors and into the back storage hallway, what used to be the old maternity wing. Most of the cabinets were empty. Some still held stray supply bins, folded linens, spare equipment tags. Everything newer than 2000 had already been scanned. Then, behind a freestanding exam light, the agent noticed a rolling file cart. It wasn't labeled. The wheels had melted slightly into the linoleum. Inside the cart, 3 binders, handwritten, 2 with water damage, 1 intact. The cover read, "Neonatal Transfer Log, June 1991. It wasn't listed in the digital archive. It hadn't been scanned. It wasn't supposed to exist. The entries were faded but legible. Most followed the same pattern: patient name, birth time, weight, attending physician, transfer time, initials. On June 4, 1991, there was 1 entry with no weight, no APGAR score, no attending, no initials. Only the words, Del, female, 4:16 a.m., transferred OBS. The line beneath it had been blacked out with thick, permanent marker. It was the only redaction in the entire binder. The agent didn't comment. They took photographs, logged the binder, tagged it for evidence. That evening, the file was added to the open review case attached to the Delgado audit flag. 3 days later, the discrepancy was elevated to Tier 2 status. It triggered a second notification, this time sent to the Office of Records Validation. And that's when Rosa's name resurfaced. She was still in the system, still listed at her last confirmed address, an apartment building she'd managed for 8 years before, quietly retiring in 2021. An investigator from the Public Health Review Board was assigned to make contact. Her job wasn't to investigate the disappearance. Her job was to inform the mother that a birth record had been located, and that she had the right to request a formal copy. That's what she planned to do. What she didn't expect was what Rosa said when she picked up the phone. "You found her, didn't you?" There was no shock, no confusion, no request for clarification, just the question Rosa had never dared ask out loud. The investigator didn't know how to respond. She told her the record had been recovered. And Rosa, after a long pause, said, "She wasn't dead. I knew it." Then she hung up. The call was logged at 2:11 p.m. on a Wednesday. The investigator filed it as responsive, emotionally neutral, possible prior knowledge. No follow-up was required, but the tone of the conversation raised a flag. A supervisor reviewed the transcript and instructed the records unit to begin trace contact with any corresponding birth certificates filed within a 24-hour window of Rosa Delgado's June 4, 1991 delivery. That's when the second anomaly appeared. A woman in Kansas had recently filed an application for a delayed birth certificate. Her name, Harper Morales. Age, 33. Adopted at birth. The request came with a notarized letter from a private attorney, along with the results of an ancestry DNA test that showed no biological relation to the family that had raised her. The birth hospital listed on the form was Mercy Valley, Fresno County. The year was 1991. No match appeared in the standard birth registry, but the digitized archives, now partially restored, showed a previously orphaned patient ID, infant female, Delgado. Date of birth, June 4, 1991. Transfer time, 5:02 a.m. The address listed in the records didn't exist anymore. The ID hadn't been used in over 3 decades. A match request was sent to the Kansas Vital Records Department. The original Harper Morales birth certificate was redacted in 1992 under a sealed private adoption. The law firm involved had since dissolved. No foster documentation remained. But the biological profile from the DNA submission was clear. The maternal match was confirmed. A 99.98% probability. The system linked the two records, one stillborn, one transferred, both originating from the same hospital, within the same hour, under the same maternal name. That's when the file was formally reclassified. Not a clerical error, not a duplicate, a disappearance. The Public Health Department contacted Harper Morales through her attorney. She agreed to speak. She declined an in-person interview. The call lasted 6 minutes. She was polite, cautious, measured. She said she'd suspected for a while, that things didn't line up, that her records never made sense, that her mother, the one who raised her, had always deflected questions. She had found the hospital name on a scan of her childhood medical files. That was how she started searching. She didn't want press. She didn't want to reopen anything. But she said something at the end of the call that stopped the agent cold. "I don't know who she is," Harper said, "but I have a drawing from when I was little. I wrote a name on it. I don't know where I heard it." The agent asked what name. She said, "Isabel." The same name Rosa had once written in the corner of a notebook. The one she never showed anyone. The one she had never spoken aloud. No one ever told Harper that. And no one told Rosa, when she answered the door 3 weeks later, that the woman standing on her porch would say it. Not as a guess, but as a memory. The meeting was held in a state office building off East Belmont. Neutral flooring, no signage, 1 table, 2 chairs, no press, no observers. Rosa arrived first. She wore a plain gray sweater and carried nothing with her. She sat down without speaking. Her hands were folded. Her posture didn't change. Harper arrived 11 minutes later. She entered without hesitation, but didn't make eye contact. She held a small envelope and a stack of printed documents bound with a rubber band. They sat across from each other in silence for almost a minute. Then Harper opened the folder and laid out what she'd brought. There was a photocopy of her amended birth certificate, name, date, no father listed. The section for place of birth read, "Unknown." That was standard for private adoptions in the early 90s. She had a scan of her DNA results. Confirmed maternal match, Rosa Delgado. Certainty, 99.98%. There were also 4 medical records from her early childhood, pediatric checkups from clinics in Kansas City. No primary guardian listed, all signed out with cash. The handwriting on one form matched the initials found in the old transfer log. But none of that was why Rosa had come. The investigator seated in the corner of the room kept quiet as Harper reached into the envelope. Inside was a single sheet of paper, typed, transcribed from memory. She slid it across the table and said, quietly, "This is what was written on the note they found with me." Rosa read the words, "I'm sorry I couldn't protect you." There was no signature, no date. Just that one sentence. She didn't react, didn't reach, didn't cry. But her hand closed slightly on the edge of the paper. A small shift, like something under her ribs had finally exhaled. The investigator asked if she recognized the phrase. Rosa nodded once. She said she had written it on the back of her discharge form, hours after delivery. The nurse had taken it without speaking. She had never been told if it was included with the body. Now she had her answer. There were no baby clothes recovered, no hospital tags, no keepsakes, no photographs. The woman who had raised Harper had died 2 years earlier. No will, no guardianship documents, no letters left behind. The only other item Harper had was an envelope from the adoption agency, unopened, still sealed. She placed it on the table. Rosa didn't touch it. "I didn't open it," Harper said. "I didn't want the version they gave me." Rosa didn't respond. The investigator collected the materials, logged the forms, and concluded the session. They left without hugging. There was no reunion photograph, no release statement. But Rosa asked if she could keep the paper, not the birth certificate, just the sentence. Harper nodded. And that was it. Not a beginning, not a closure. Just a sentence carried forward across 34 years and handed back to the one who had written it. The final files arrived in January, mailed in a padded envelope with no return address. Inside were photocopies, scanned, rescanned, some nearly illegible. The documents included hospital billing statements from a private pediatric care group in Topeka, Kansas, dated 1992 to 1995. 3 annual wellness checkups. One record showed immunizations billed under a false patient ID. Another listed Harper Morales under an alias, Emily Cortez. None of the forms listed a parent's name. All insurance fields were left blank. Each visit was marked as paid in cash. The physician attached to the account had died in 2006. His practice had been closed for over a decade. His office files had never been digitized. But the handwriting on the intake form from 1993 didn't match Harper's adopted parents. And it didn't match the mother's file from Mercy Valley. It matched another set of notes found in the neonatal transfer log, a nurse's script from the hospital's East Wing, logged next to the redacted entry at 5:02 a.m. That nurse was never identified. A state investigator attempted to locate her through archived payroll records, but the files were incomplete. The hospital had changed ownership in 1998. Legacy employee IDs had been deleted. The wing had been shut down and remodeled during the first expansion. No current employees could recall who had been working maternity that night. And no one could explain why one of the infant transfer slips was typed when all others had been handwritten. There were no surveillance tapes. The cameras in the neonatal unit weren't active in 1991. The only surviving footage from that week had already been erased during standard archival purges. But one clue remained. Inside the digitized folder, embedded deep in a metadata string, was an internal note attached to the transfer form. It was never meant to be visible. It was only accessible by directly querying the archived code. It read, "Filed manually. Confirmed by RA. Use alternate exit." The initials RA didn't match any physician, nurse, or administrator on staff that year. There was no alternate exit listed in the floor plans. The hallway where the old emergency fire door had once stood was now drywall. When engineers were sent to inspect the area, they found signs of reconstruction. Sheetrock laid over concrete, a lock plate mounted behind the wall, electrical junctions wired but capped. Someone had sealed an access point, and no one could explain why. It wasn't enough to confirm wrongdoing, not enough to reclassify the case. But it introduced a new question. If Harper hadn't been adopted legally, and if Rosa had never signed a release, then how did she leave the hospital? The answer wasn't in the forms. It was in the gaps. The missing nurse, the cash payments, the duplicate birth record with no signature, the redacted line, the exit that no longer existed. Someone moved the baby. Someone knew what they were doing. And someone, at some point, made sure she wouldn't be found. For 34 years, it worked. Until now. Harper didn't want to meet with press. She refused interviews, declined media outreach, and rejected multiple requests from advocacy groups. She wasn't interested in podcasts, books, or closed-door conversations. She gave one statement to the Office of Public Health. It was 6 lines long. "I do not remember being taken. I was raised by people who I believed were my parents. I did not suspect otherwise until age 12. I requested my adoption file at 29. The information was incomplete. I submitted my DNA out of frustration. I did not expect this." She asked that no other comments be made on her behalf. But over the course of several months, Harper spoke occasionally to a caseworker assigned to her by the Reunification Board. Their conversations were not recorded, but notes were kept. She did not talk about the woman who raised her. She talked about things that didn't make sense. A house with no family photos. A last name that changed when she was 7. A nurse who visited once a week until she turned 3, but was never allowed to speak directly to her. A locked cabinet in the laundry room. A man who left before she could remember his face. She recalled being told she was special, but not why. She said there were no baby pictures, no hospital keepsakes, no stories about her birth, just a date and a state. At one point, she said something that the caseworker wrote down word for word. "I used to dream about walking past her in a hallway," she said. "I didn't know who she was, but I'd see her standing by a vending machine. She never looked at me. I never looked at her. We just kept walking." The caseworker asked when the dream started. She said she didn't remember a time when they weren't there. After her match with Rosa Delgado was confirmed, she stopped having them. No therapist could explain it. In February, she submitted a written request to visit the hospital where she was born. The facility approved it under supervision. She was walked through the lobby, the main hall, the West Wing, now converted into pediatric rehab. When she passed the elevator alcove, she paused. She asked if the vending machine had always been there. The supervisor said yes. Harper stood quietly for a moment, then turned away. In her follow-up with the caseworker, she offered one final reflection. "She didn't look like I expected," she said, referring to Rosa, "but she sounded right." When asked what she meant, she said, "She didn't try to explain. She didn't try to claim anything. She just listened." Harper asked that no contact schedule be arranged, no reunion framed, no ceremony made of it. She didn't want answers. She just wanted confirmation. And she got it. Not from a file, not from a form, but from a stranger's silence. The case was never reopened. After the match was confirmed, no charges were filed. No agency accepted responsibility. The digitization contractor was cleared of liability. The hospital had changed ownership. The Department of Public Health marked the case resolved. No press release. No official apology. No record correction for the transfer log. Harper Morales received a new birth certificate in March. It listed Mercy Valley as her place of birth. No father. No attending physician. Her mother was named as Rosa Delgado. She kept the document in a file drawer. She didn't frame it. Rosa declined media requests. She moved into a smaller apartment. The mailbox had no name. She didn't notify her former landlord or employer. She left no forwarding address. They met only once after the confirmation. A quiet public meeting near a library parking lot. No hug. No press. No witnesses. Harper brought an envelope. Inside was the only item Rosa had asked for. She didn't open it while Harper was there. When Harper stood to leave, she paused before walking away. "She waited for me," she said, even if she didn't know it. Rosa didn't respond. They walked in opposite directions. No one filed a complaint. No one pursued the redacted entry in the neonatal log. The original note was still missing. The hallway where the transfer exit had once existed was sealed over during renovations. The nurse listed on the 1991 staffing chart had long since disappeared from state records. The only reason Harper had ever been found was because of a flag in a misfiled digital record, a glitch. And what that glitch revealed still had no official explanation. 2 entries. Same mother. Same minute. 1 dead. 1 transferred. No burial. No autopsy. No paperwork. Just a sentence, remembered by someone who was never supposed to hear it. Rosa didn't keep the birth certificate. She didn't keep any of the forms. But she kept the page Harper brought her, not for the words on it, but for what it proved. She folded it once and placed it in a small drawer in her nightstand. She didn't label it. She didn't tell anyone. She never took it out again. Because some truths don't return with clarity. They arrive quietly, wordless, like breath that never should have been there. And once they arrive, they don't ask for recognition. They just sit in the silence they left behind. If the record says she never lived, then who made sure she was never found?